Welcome back to the Better Health Now podcast. Today I sit down to talk with Kayla Witte, a physical therapist here at Cullman Regional. Kayla graduated from the University of South Alabama with a Bachelor's of Health Science with a concentration in physical therapy in 2016 and a doctorate in physical therapy also at USA in 2018. She treats a variety of orthopedic conditions at Cullman Regional, and she is currently working on a pelvic rehabilitation practitioner certification from the Herman and Wallace Pelvic Rehabilitation Institute. Thank you for taking the time to sit down with me today. I'm looking forward to discussing the work you're doing here at Cullman Regional. First, I'd like to discuss sort of your path to get to Cullman Regional and what ultimately led you to join Cullman Regional after your time at University of South Alabama.
So I'm a Cullman native. I've been here since I was born. I graduated from Cullman High School in 2012, and I really just enjoy this community. When I graduated from PT school, I knew that I was pregnant and wanted to move back to be closer to family. And so this was a perfect opportunity. I had contacted Leanne and Bridget, and they ultimately brought me in for an interview, and I just fell in love with the staff and my time here actually in clinicals. Also just kind of nailed that in for me, and I just really enjoyed the environment that I was in and just kind of felt like a family versus just a workplace.
Yeah, and like I said, you were familiar with the area. You'd grown up here. You'd seen it grow as you've grown up here too, and being able to come back and pour into the city is probably a huge driving factor for you.
Absolutely.
So what ultimately drove you to kind of pursue that career in physical therapy? Was that something you always knew you wanted to do? Did you have did you job shadow someone in high school, or what ultimately led you to kind of go in that direction?
So I felt a passion for the healthcare field from a young age. My mom and my grandmother, unfortunately, were not happy with that. Well, they just were sad because they're both accountants. They wanted me to go into that same field. But I really wanted to be an OBGYN, actually, when I was in high school. But I found that there were different facets of physical therapy that could be pursued. I was on the swim team in high school, and so I came up here after my grandfather fell and broke his hip, and he was doing aquatic therapy here at Cullman Regional Outpatient. I got to shadow with Lisa Ann, who was working here at the time, and really kind of delve into what that looked like. And I was like, cool, I could be in a pool all day for work. Who wouldn't?
This is the best of both worlds.
Right. And so that just kind of jump-started me to look into the physical therapy field and what it offered. And I fell in love with that aspect of the job. And so I went to PT school, and unfortunately, they don't give a lot of in-depth for pelvic health. But it just kind of piqued my interest because I had that interest of being an OBGYN, and that is something I could carry into pelvic health, women's health, into my field as well. So that's what ultimately brought me to physical therapy and then into the pelvic health field.
Yeah, so you said that the pelvic health side of PT wasn't really talked about too much while you were in school. Is that something that's because it's fairly new, or is it just because it's a very particular area of PT and it's just hard to kind of cover that specific one while you're in school studying?
Definitely a specific area. So a lot of school is based on orthopedics, neuro that you would see like maybe post-stroke or post-surgery. Whereas if I have these extra niches like wound care or pelvic health, or let's say you want to specialize and just be orthopedics, you have a specialty course and ultimately can sit for a specialty exam to add additional credentials to your title. So that is where they kind of introduce it to you, but then it's up to you on what path you want to take, whether you want to be a general practitioner or if you want to seek a specialty course and a specialty certification.
Yeah, so and that's obviously kind of the topic of today's conversation is that pelvic floor physical therapy. For those who are listening and may not know, and even for myself, what is pelvic floor physical therapy, and what are some of the reasons that someone might come in to begin that treatment?
So I think Herman and Wallace has a really good definition of it. They define it as a non-surgical approach to rehabilitation of dysfunctions in the pelvis that contribute to bowel, bladder, sexual health, and pain complaints. Approaches can be both behavioral strategies, manual therapies, also include modalities, therapeutic exercise, education, and functional retraining. So some of the things that I see a lot are incontinence. So women that are experiencing continence. Yes, it's common, but it's not normal. You should be able to withhold urine from your bladder and be able to make it to the bathroom. But a lot of times after, pregnancy or just in general age, that's not something that we're able to maintain. So we need exercise and training to be able to maintain that through our lifespan.
So what does the sort of the process look like for a patient coming in? What are sort of the symptoms they might have, and what are sort of the first steps that you take in helping them find relief?
So I would say a lot of times it's with pelvic health in general, it does tend to cater more towards women because they're going for those annual checkups with their OBGYNs or family practitioners and kind of getting that checkup with them. So pelvic pain, incontinence, whether it be bowel or bladder, pain with penetration, whether it be from menstrual cycles or other, that kind of would be the initial, hey, something's not right here.
Okay.
And they may bring that up to their family practitioner, their OBGYN, or a specialist that they're seeing. And at that point, it would be a discussion between the patient and their physician to get a referral for physical therapy.
Okay.
And then they would schedule that with physical therapist, whether it be me or someone else. Their doctor can search either on the Herman and Wallace website or the APTA website for a pelvic health specialist that may be in their area.
Okay, so is the pelvic health specialist, was that something new that you when you came to Cullman Regional that you were able to, like, you had that passion to pursue and you were able to offer something that they didn't have prior, or was there people already offering that here at Cullman Regional prior?
So we did have specialties here. We had the Big and Loud program and we had the lymphedema program, but pelvic health was actually something new that I spoke with my recruiter here that we were able to implement in my contract for me to be able to get certified through that. So I have taken the courses that are appropriate for me to sit for the exam through my contract, and I just continue to take courses to better my knowledge and understanding so that I can help more people in our community.
Yeah, and so you said that, when the patient comes in and they get the referral, when does that patient begin seeing relief? Is it does it take, a month? Does it take a few months for them to go from, we have this discomfort to, hey, we found this solution and we fixed the problem?
So everyone's different. I tend to say give it at least 2 weeks for your body to adjust to the exercises or the changes that we're trying to implement into your life. It's not going to be instantaneous because a lot of times when you come in for this, any pelvic issue really, it's typically, what's the best way to say it? Is typically embarrassing for the patient to bring up. So a lot of times it gets kind of pushed to the side for a while, and then it becomes relevant enough for them to be like, hey, this is really impacting my daily life. How can I change this? So I would say at least 2 weeks to give your body time to adjust and implement into your routine. At that point, 6 to 8 weeks, you should be getting some relief or see some change in your body and how it's functioning in those problems that you come to me or another pelvic health practitioner for.
Gotcha. Okay. Is the treatments, obviously the treatments are specific to the individual. Every patient's a little different, but is there certain things that you see that, like, you're offering a lot of the similar treatments patient to patient because it seems to work to relieve that particular issue? Or is it still sort of a, when you're meeting with that patient for the first time, trying to figure out exactly, what exactly is that discomfort? What is it? What is the pain points for them specifically?
So it depends on, is it pain? Is it incontinence? Is it weakness? Is it muscle tension? There's different facets that can modify the patient's treatment.
Okay.
The other thing to think about too is that everybody's going to approach it differently. So some people may be like ready to jump in and like, let's do all the things. And then other people may be like, okay, I know this is an issue. I'm ready to start, but I'm going to have to take some time to get really involved in this because for some people it can be a sensitive subject, and I understand that. And what I would like for patients to know is that anything that I do with you or initially, like treatment-wise, I've had it done to me.
Okay.
As part of those courses, I have to be trained to do it and to feel what it feels like for the patient.
Yeah.
So everything that I do, I've had done to me as well.
Yeah.
And so I understand that it can be a very touchy and sensitive subject or topic. But I want you to feel confident and comfortable in coming to me because I'm ultimately here to help you. In PT school, we take an oath to help, not to harm. And so that is really what I try to portray in my patient interaction.
Yeah, and I think it's a testament just to your dedication with going through this certification. It's a long process, and like you said, you're being able to experience what you're portraying to your patients, and like you said, firsthand what it looks like, what it feels like, and being able to guide them in the best direction. With the name of this podcast being The Better Health Now, how does that promise of getting better every day apply to the work that you do, and what does that promise mean to you?
I think that better health in general, it can be a small step, it can be a large jump, but that you're taking the initiative to better yourself in any way.
Yeah.
And to me, for pelvic health, it's shedding light on those things that maybe people have been pushed aside for, or not necessarily advocated for, that they don't feel that people are stepping out and helping them in that regard. And I feel like pelvic health specifically just kind of brings light and justification to how they feel.
Yeah.
They're able to talk to me about things that maybe they wouldn't talk to their family about or a significant other, because it's whether it's embarrassing or just not something that is good table talk.
Yes, for sure. So if you were to see a headline about the work you're doing with pelvic health this year in 2024, maybe in the next few years, what would you want that headline to say?
It was a great headline that we had at Pelvicon 2023. Everybody has a pelvis. And it's true. Men and women alike both have pelvis, and we both have a musculature that is involved in that. So everybody can be treated for this. It's not women specific. And if you have an issue that you feel that needs to be dealt with that I can help with, or another pelvic practitioner can, reach out to your doctor. So everybody has a pelvis. Everybody can be treated.
Well, thank you for taking the time to sit down with me today. It's been great learning more about the work that you do here at Cullman Regional, and I continue to look forward to the impact you'll have in your patient's life here at Cullman Regional. If you're listening and you want to find out more about Cullman Regional or any of the work being done here, you can visit our website, cullmanregional.com today. But thank you again, Kayla, for taking the time to sit down and talk with me.
You're welcome. Thank you for having me in.